Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering part 2 pharmacology. Now, before we get into it, I want you guys to know that I am now on TikTok. As you know, I'm technologically challenged, but I'm making it do what it do. So make sure you guys go on TikTok, check me out. Same name, Nexus Nursing. So without any further ado, guys, let's get started. First question. A 13-month-old child is admitted to the emergency room with salicylate poisoning. Her mother found her beside the empty bottle of adult aspirin. She says there were about 10 aspirin left in the bottle. What manifestations would the nurse expect to see in the child? 1. Bradypnea and pallor. 2. Hyperventilation and hyperpyrexia. 3. Subnormal temperature and bleeding. Or 4. Melena and bradycardia. If you're new to my channel, just press the pause button, go over the question, formulate your answer. Whenever you're ready, press play and we will resume. Okay, guys, so the correct answer is hyperventilation and hyperpyrexia. The correct answer is number 2. What happens is, guys, with an aspirin overdose, it causes the metabolic rate to increase. So the first one, hyperventilation, I want you to think about it. That metabolic rate increases. The patient starts to do it. Why? They're trying to blow off all that CO2 because that patient's going into what? Metabolic acidosis. Secondly, hyperpyrexia. Why do we see that hyperpyrexia? Why do we see that temperature going up? Because the metabolic rate is increasing, okay? And that's why we see that temperature going up. So the correct answer for this one is hyperventilation and hyperpyrexia, and that's because of that metabolic acidosis that the aspirin toxicity causes. Next question. A toddler who has swallowed several adult aspirin is admitted to the emergency room. When admitted, the child is breathing but is difficult to arouse. What is the immediate priority of care? 1. Administration of syrup of ipecac. 2. Cardiopulmonary resuscitation. 3. Ventilatory support. Or 4. Gastric lavage. And I'll give you a moment to think of your answer. And the correct answer is 4, guys. With an aspirin overdose, your number 1 priority is to get rid of that aspirin in the child's system. How are you going to do it? By gastric lavage. That's going to be your priority. You got to get it out of that child's system. Now, let's go over the other choices. You have 1, administer syrup of ipecac. I'm about to age myself. There was a time in nursing where we did do this, and this was like 15 years ago. This is hardly even ever used again. I mean, it's hardly ever used anymore, okay? It's a syrup that induces vomiting. We don't use that anymore. That's wrong. Choice 2, cardiopulmonary resuscitation. Why are we going to do CPR? It says that the child's breathing. If they're breathing, we know their heart is beating. Why are we doing CPR for? That child is breathing, not necessary. 3, ventilatory support. It says the child's breathing. It's hard to arouse them, but they're breathing. Why are we going to put them on ventilatory support? Our priority right now is to get that aspirin out of their system, and we do that by what? Gastric lavage. Moving on. An adult client is on call for the operating room. The pre-op medication orders for meperidine, that's your Demerol, 100 milligrams IM, and atropine, 0.4 milligrams IM. The operating room calls at 11 a.m. and requests that the client be medicated. The nurse notes that the client last received meperidine for pain at 10 a.m. What is the most appropriate intervention for the nurse to take? 1. Give the pre-op medication as ordered. 2. Give half the dose of meperidine and all of the atropine. 3. Check with the anesthesiologist before administering the medication. Or 4, withhold the meperidine and the atropine. And the correct answer, guys, is 3. You're going to call the doctor. It's too soon. If you go back to the question, it says they call at 11 o'clock for the patient to be medicated, but they were just medicated with this narcotic an hour ago. So are you going to just blindly give this medication? Absolutely not. You're going to call the anesthesiologist and say, hey, I know you want me to give this, but this is what the patient got an hour ago. Do you still want me to give it? Is there something else you wanted me to give? Do you want to lower the dosage? You call that doctor directly for other orders. You withhold that medication. You do not blindly just give it. Our other choices, let's see. 1, give the pre-op medication as ordered. Absolutely not. It's too soon. You're going to call the doctor for clarification. You have to show the test writer that you know what's going on. You have to show the test writer that you realize there's a problem here and you're doing something about it. Choice 2. Stop it. Stop it. You either give all the medication or you don't give anything at all. How you going to give half a dose? Oh, we playing doctor now? Is that what we're doing? I don't think so. When the doctor orders a medication, you either give that medication because it's appropriate or you hold it back. You don't give it and you call the doctor for clarification. You don't decide that you're going to give half. You're not the physician. You don't write that order, and that's how you're going to lose your license. You don't do that, okay? So that's crazy. We get rid of that. Choice 4, withhold the meperidine. Okay, I'm with that so far. And the atropine. The atropine's not the problem. The meperidine's the problem. So we're going to hold the meperidine and call the doctor for further instructions. So that's why 3 is the correct answer. Moving on. An adult client had an abdominal hysterectomy this morning. Meperidine, HCl Demerol 75 milligrams IM every 3 to 4 hours as needed for pain is ordered. At 9 p.m., she complains of lower abdominal pain. She was last medicated at 5:45 p.m. What is the most appropriate initial action for the nurse to take? 1, offer her a bedpan and a back rub. 2, reposition her. 3, administer the meperidine 75 milligrams IM. Or 4, encourage relaxation and breathing techniques. The correct answer is 3. You're going to give the medication. You're within the time frame. It's appropriate. So you can give this medication. Now let's look at the wrong answer choices. 1, offer bedpan and a back rub. This patient's getting meperidine. This is a narcotic, okay? So this is heavy duty pain this patient has. What is that back rub going to do for the patient? And by the way, if you've been following me for any amount of time, I've already told you that back rub crap, you leave that in Foundations, Fundamentals of Nursing. Okay, we don't do that anything past Foundations, Fundamental of Nursing. All right, we don't rub a patient, we don't massage a patient because we're not trying to loosen any clots. So no, we're not going to do that, especially with the pain that patient needs. Meperidine, a back rub is not going to do anything for that patient. Moving on. Choice 2, reposition. For what? Tell me what repositioning that patient's going to do for that pain that that patient's having. Look. If you go back to the question, it says that the patient had abdominal hysterectomy. So how is repositioning them going to help them with the pain post-op? Keep it moving. Choice 4, encourage relaxation, breathing, and exercises. Guys, it's within the time frame for the patient to get their medication. Give them their medication. Now, if it was a different situation where it wasn't time yet for that patient to get their medication, and the patient was like, oh, they're starting to feel uneasy. They don't have severe pain. They're not talking about pain on a level 10, 9, or 8, but the pain is starting to creep up. There's maybe a 2 or 3. Then you can talk about relaxation and breathing exercises and distraction, all that other good stuff, but not with this type of pain. Okay, this is severe pain the patient's having, and it's well within the time frame. Give the patient their pain medication. Next question. An adult client has rheumatoid arthritis. Aspirin 975 milligrams every 4 hours as needed is ordered for pain. At 2 p.m., the client requests pain medication. Aspirin was last given at 9:30 a.m. What is the most appropriate initial action for the nurse to take? 1, give the aspirin as ordered. 2, question the order because it's higher than normal. 3, attempt to divert the client's attention from the pain. Or 4, assess the nature of the pain. I hope you did not choose number 1 because that was a trick question. You're going to assess the nature of the pain. Why? Why, Professor D? Last time this patient got the med, it was 9:30 in the morning. It's 2 in the afternoon. It's within the time frame. Why wouldn't we just give it? Go back to the question. It says the patient's complaining of pain. What kind of pain? This patient has arthritis, but what if the pain they have is a severe headache? What if the type of pain they have is a stomach ache? What if the type of pain they have is rectal pain or pain coming out the vagina or the penis? We don't know. So before you just blindly give the pain med that's supposed to be for the arthritis, we have to ask them what kind of pain they have. Is it arthritis pain or is it another type of pain? Because if it's another type of pain, what are we going to do? ADPI, assess first. If it's stomach pain, listen to the bowel sounds, ask them questions. When did they last eat? Have they passed gas? We're going to assess first. And then you're going to go through the whole assessment, diagnosis, plan, intervention, and of course, evaluation to see if your intervention worked. But you have to assess first. So we're not going to just blindly give the medication. We have to make sure that it's arthritis pain that the patient is having and not something else. Okay. So that's why the correct answer is 4. Assess the nature of the pain. So I explained why number 1 is the wrong answer. 2, question the order. Nope. That's within normal limits. 3, attempt to divert the Stop it. So a patient says that they're in pain and we're going to try to divert their attention away from, we're not even going to ask them what kind of pain they have, what's going on with them. We're just going to try to distract them. Where? In what world? Absolutely not. We're going to assess, get information so we can figure out what our next nursing intervention for that patient is going to be. A 68-year-old man has been diagnosed as having Parkinson's disease. He started on Cogentin 0.5 milligrams by mouth daily. Which nursing action is most essential at this time? 1, monitor his blood pressure and pulse. 2, encourage cold beverages and hard candies. 3, observe for rashes. Or 4, monitor his stools for fluid loss. I love this question. The correct answer is 1, guys. Monitor his blood pressure and pulse. Now, Cogentin, this is an anticholinergic, and you guys know it blocks acetylcholine, right? And so I tell my students this all the time, that poem for the anticholinergics: can't see, can't spit, can't pee, can't, right? So patient has the blurred vision, they got the dry mouth, they got the urinary retention, they got the constipation. Those are side effects that come with anticholinergic meds. Okay. So let's look at our list, and I want to show you how these test writers will try to trick you. But guys, this is where you use your critical thinking. This is where you use your priority and delegation. What is most important? Okay, so I told you 1 is the answer. You're going to monitor the blood pressure and pulse because Cogentin can cause it to increase, right? Let's look at our other choices too. Encourage cold beverages and hard candies. Even though that's true, if a patient's taking anticholinergic, you want to encourage fluids and hard candies. Why? Because of the dry mouth. But is that going to take priority over a physiological status such as blood pressure and pulse? Absolutely not. Because guess what? Blood pressure and pulse can kill a patient. Dry mouth can't. So we care more about the blood pressure and the pulse. Choice 3, observe for rashes. That's not a common side effect of Cogentin. Even if it was, it wouldn't take precedence over physiological integrity such as blood pressure and pulse. Choice 4, monitor for stools. Monitor his stools for fluid loss. Actually, we would expect constipation. Remember, can't see, can't spit, can't pee, can't. So the patient will be constipated. So anyway, regardless, our priority for this medication in the list that was given is going to be physiological status. Guys, I cannot drill this into your heads enough. Your priority will always be anything that keeps that patient alive. Physiological integrity. Vital signs such as blood pressure, pulse, respirations, right? Nutrition, fluid electrolyte, glucose, their hemodynamic status. Anything that physically keeps the patient alive. Remember Maslow's hierarchy of needs? Everything on the bottom of that pyramid is physiological integrity. Everything that keeps that patient alive. Those are always going to be a priority over anything else. All right, moving on. As a young adult, 20 years old, who is hospitalized for the first time with schizophrenia, they're receiving, I can't pronounce, chlorpromazine, thorazine, 75 milligram by mouth 3 times a day. Declines to go home for a weekend pass. Which statement that the client makes would indicate a need for nursing intervention? I'm sorry, guys. I have allergies. Whenever I come into the studio to record, my nose runs. 1, I won't drink any alcohol this weekend. 2, it will be good to taste home-cooked food. 3, we plan to go dancing. 4, I'm looking forward to a relaxing weekend at the beach. And the correct answer is 4, guys. This Thorazine, that's an antipsychotic. And one of the adverse effects is photosensitivity. This patient needs to keep their skin covered if they have to go out into the sun. The large straw-brimmed hat, or is it large brim straw hat? I think it's large straw brim hat. Anyway, a big hat to cover the head, sunglasses, long sleeves. They need to cover their skin because of photosensitivity, okay? Choices 1, 2, and 3 are all great. Nothing's wrong with it, so it wouldn't need further intervention. Whenever you guys get a test question asking you which one needs clarification, which one needs further teaching, which one needs questioning, all of that means which one's the wrong answer. So you're going to be looking for the wrong answer to choose. Next question. An adult client is receiving lithium 600 milligrams by mouth 3 times a day for the treatment of bipolar disorder. The client should be taught that it's important to have adequate amounts of which substance? 1, potassium, 2, sodium, 3, calcium, or 4, magnesium. And the correct answer, guys, is sodium. What number is sodium? 2. This is a famous test question, especially for psych, okay? Any patient that's taking lithium, you better be checking their sodium levels, and you need that sodium level to be within range. What's the range? 135 to 145. That is your normal range for sodium. You don't want it less, and you don't want it more. Here's why. When the sodium level is less than 135, that's hyponatremia. Guess what? That puts the patient at risk for lithium toxicity. And when the sodium is higher than 145, which is hypernatremia, that puts the patient at risk for getting a subtherapeutic level of lithium. Okay? So it's very important that you keep it 135 to 145. And don't forget your lithium level. Very important. You have to constantly be checking that level because we don't want the patient to have lithium toxicity. 0.6 to 1.2. That is your lithium level. That is your safe range, okay? Anything more than 0.6 to 1.2. So anything more than 1.2 is too high a range. Once you hit 1.5, that patient's in lithium toxicity. So safe range for lithium is 0.6 to 1.2. But once you hit 1.5, that patient has reached toxic levels. And remember, when patients taking lithium, we want to continually check the sodium levels and make sure that sodium is 135 to 145. An elderly client is scheduled for a repair of a fractured femur this morning. The nurse goes in to administer a pre-op medication of Demerol 75 milligrams and atropine 0.5 milligrams IM. The client asked the nurse if he should take his eye drops before surgery. What is the best initial response for the nurse to take? 1, you can take them when you get back from surgery. 2, I'll give them to you now. 3, let me check with your physician. 4, what kind of eye drops are you taking? I think you guys are starting to see a theme here, right? 4, what kind of eye drops are you taking? Guys, let's say in this question, in this situation, you don't even recognize the importance of what's going on here. It's gone totally over your head. That's okay, right? Well, it's not okay, but I'm just saying. You have no idea. If you've been following me for any amount of time, you should know, even if I have no idea what's going on, let's err on the side of precaution and ask questions. Let's do what? Assess. And that's exactly what you're going to do. What kind of eye drops are they? Why? Let's go back to the situation. And it says that the patient is to get Demerol grade and atropine. What is a contraindication for atropine? Glaucoma. If a patient has glaucoma, they can't be taking atropine. So you better ask them what kind of eye drops they're taking. Why? You want to make sure that we didn't miss something, that patient has glaucoma. That's exactly why you're asking. Now let's look at our other choices. One, you can take them when you get back from surgery. So you're going to tell the patient that they can take eye drops and you don't even know what kind of eye drops they're taking? Moving on. 2, I'll give them to you now. Really? Okay, you're going to mess around and lose your license. 3, let me check with the physician. What are you going to tell the physician? Hey doc, yeah, my patient just asked if they could take their eye drops. What? What kind of eye drops? Ask questions you want to assess. So 4 is the answer. I think I'm getting on your nerves with this video, but that's okay, guys, because I need you guys to pass your pharmacology, HESI, ATI, whatever it is. I need you to pass it. Moving on. A 68-year-old client was admitted with CHF, has been, guys, you know I can't pronounce, has been digitalized and is now taking a maintenance dose of DIG 0.25 milligrams by mouth daily. The client is to be discharged soon. Which assessment is of most immediate concern to the nurse? 1, the client's apical pulse is 66. 2, the client says that he's nauseous and has no appetite. 3, the client says he will take his pill every morning. Or 4, the client has lost 8 pounds since his admission 1 week ago. And the correct answer, guys, is 2. The client says he is nauseous and has no appetite. Nausea, anorexia, diarrhea, blurred vision, all of these symptoms in a patient that's taking digoxin, what does that lead you to? DIG toxicity. And that's exactly what we're going to suspect for this patient, okay? We want to keep the DIG levels between 0.5 to 0.9. It's a very narrow therapeutic range. And these meds that have narrow therapeutic ranges, that means just a little bit over and you threw that patient in a DIG toxicity. 0.5 to 0.9. If we are giving that patient DIG for congestive heart failure, 0.5 to 0.9, very narrow therapeutic range. And anything higher than that 0.9, you can throw that patient into DIG toxicity. Hence, the no appetite, nausea, blurred vision, decreased vision, diarrhea, all that good stuff. All of those are signs and symptoms of DIG toxicity, which we want to avoid. Now, how should I do that? Okay, let's go over the other choices, and I have to tell you something. Let's go over the wrong choices. 1, the client's apical pulse is 66. There's nothing wrong with that. The apical pulse is supposed to be 60 to 100. That falls within the normal limits. Let's keep it moving. 3, the client says he'll take his pill every morning. Absolutely, you're supposed to. Great. Choice 4, the client has lost 8 pounds since his admission 1 week ago. That's a good thing. Why? Because you're thinking, wait, they lost 8 pounds in 1 week. That's bad. Not when that client has CHF. CHF, that patient is holding on to so much fluid that heart cannot pump out all that fluid that the patient's retaining. So the heart gets weaker and weaker because it's trying to pump out all this fluid, but it just doesn't have the strength. So let me explain to you guys what digoxin does. Digoxin strengthens the contractility of the heart. So that patient had all this fluid, and at first the heart was going like this because there was too much fluid, right? But digoxin helps it go like this and just push out all of that blood. However, although it strengthens the contractility of the heart, it also slows down the heart rate. And that's why before you ever give a patient digoxin, you always want to check their apical pulse for 1 full minute. Why? If you check that apical pulse and it's less than 60, are you going to give the digoxin? Absolutely not. You're going to hold it and call the doctor, because guess what? They may have too much digoxin in their system. And that's why the heart rate is so low. So you're going to hold it and call the doctor. So some very important things you guys got to know. You got to know the DIG range of 0.5 to 0.9. You got to know the signs and symptoms of DIG toxicity. You got to know the action of digoxin, what it does. And of course, your nursing interventions at apical pulse for 1 full minute. Next question. An adult that has angina has been discharged on transdermal nitroglycerin, which statement by the client indicates that the client needs additional teaching. 1, I'm glad that I can continue walking. 2, I will change the site each day. 3, I will be able to continue to drink alcoholic beverages. 4, I will need to get up slowly. I'm not even going to give you guys time to think of an answer. You know what the answer is. 3, that patient needs additional teaching. You cannot drink alcohol with any meds, period, across the board. I don't care what the medication is. If it's a medication, you can't take alcohol with it, period. Any questions? Okay, moving on. A 48-year-old man is in the emergency room. He has a crushing substernal pain and is diaphoretic, apprehensive, and ashen gray in color. The cardiac monitor shows runs of premature ventricular contractions. Which drug is most likely to be given at this time? 1, lidocaine. 2, verapamil. 3, digitalis. Or 4, nitroglycerin. And the correct answer, guys, is lidocaine. Why? In the question, it tells us that the patient, where is it? The patient's got PVCs running. So most likely, what do we suspect happening? A myocardial infarction. So we're expecting lidocaine to be given to this patient with those PVCs. Now let's look at our other choices. 2, verapamil. That's a calcium channel blocker. We give that for hypertension. 3, digitalis. We give that for CHF. We just talked about that med. And then 4, nitroglycerin. We give that for angina because nitroglycerin causes what? Vasodilation. It opens up those blood vessels. So for this type of situation, if you go back to the question, look, substernal crushing pain. By the way, that word crushing is another word for severe. If you haven't watched my priority and delegation video, be sure to watch that because I go over all the important key words that you'll see to lead you to the right answer. But moving on. So they gave you that hint. Patient's diaphoretic, so they're sweating all over the place. They're apprehensive. They're scared as heck. They feel like they're going to die. And they're ashen gray in color. Why do you think they're ashen gray? Because of decreased blood flow? Duh. They're not nice and pink. You're nice and pink when you have circulation. Well, not if you're a sister like me, but I'm just saying, if you're ashen gray, decreased blood flow, okay? So which drug would you expect to be given? Again, lidocaine because of PVCs. We're expecting that that patient's having a myocardial infarction. All right, next question. A 60-year-old client has been hospitalized for deep vein thrombosis. The client's to be discharged on Warfarin, Coumadin, 5 milligrams by mouth daily. Which statement that the client makes indicates the best understanding of the medication routine? 1, I'll take aspirin for my arthritis. 2, I love to eat spinach salads. 3, I will get a blood test next week. 4, I made an appointment to have my teeth pulled. And I'll give you a moment to think of your answer. And the correct answer, guys, is I will get a blood test next week. When a patient is taking Coumadin, regularly they have to get their prothrombin time, okay? Regularly, just to make sure that the patient's not getting a toxic level or subtherapeutic level of that medication. We want to make sure that we don't throw the patient into hemorrhage status. We don't want them bleeding and we don't want them clotting either, because they're not getting enough of the medication. Now, let's look at our answer. Wait, before I even go over the other answer choices, there's something else that's very important for you to know, especially in pharmacology. They love asking about this, so make sure you guys understand this. When it comes to Coumadin, your test is prothrombin time, PT, okay? You're gonna do a PTINR. That's for Coumadin. When it comes to heparin, it's PTT. And here's how you remember. The 2 T's, PTT, those 2 T's, you put it together, kind of looks like an H, and that H stands for heparin. Coumadin, PTINR. heparin, PTT. Don't forget it. I promise you'll see it somewhere in your nursing career. All right, moving on. Let's talk about the wrong answer choices. 2, I love to eat spinach salads. Here's the problem. Spinach is green and leafy, right? Green, leafy is full of vitamin K. Guess what the antidote for Coumadin is? Vitamin K. So why would a patient be taking a medication and eating a whole bunch of food that has the antidote for the medication, which would just reverse everything the medication is doing? So absolutely not. That is wrong. And you need to know that. The antidote for Coumadin is vitamin K. And the antidote, by the way, guys, for heparin is protamine sulfate, just so you know. Choice 4, I made an appointment to have my teeth pulled. Where? You are on an anticoagulant, so you shouldn't be doing any invasive surgeries where you have a chance to what? Bleed, hemorrhage to death. So the correct answer, guys, is 3, I will get a blood test next week. And guys, I didn't even realize that I'm past my time. That was the last question. I hope you guys found this video to be helpful. If you did, please let me know in the comments below, and I'll make sure that I provide a part 3 pharmacology video for you. Please, guys, don't forget, I'm now on TikTok, and I'm going to try to provide 3-4 videos for you a week so you guys can just have lots of videos to binge through. If you haven't done so already, please don't forget, like and subscribe below. Please share my content on your social media, help my channel to grow, help support this channel so I can get more videos out to you. And of course, please, again, check me out on TikTok. Thank you for joining me, and I'll see you on the next video.